You see this new one on Amazon?
Okay.
It's amazing.
We're on Facebook?
Yeah, we're on Facebook.
And all you have to do is keep the microphone close to you.
Okay.
Because you'll be looking at Buzz, so we'll put it this way. Keep it close to you.
I usually don't.
And you've got to, if you're this far off the microphone, you're going to sound like this.
Gotcha.
So you got to get closer, just speak up. That's all you got to do.
Yeah, well,
and you'll do fine.
it's because of how I stare in your eyes. I understand.
His blue eyes.
Okay. You ready?
Yes. Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. I am here today with Doug. What's up, Doug?
How are you?
And Doug's been a patient at Buckeye for some time. I think we've done everything on you, pretty much. So we'll talk about every single service center we have, because I think you've utilized them all today. We're probably not going to have enough time. It's a 2-hour show. It's a special 2-hour show. It's not really, but we're going to cut the break and we'll be back with Doug.
I think honestly the only thing I have not done is stem.
I've done stem cells.
I've done shockwave. I've done.
I like shockwave too.
Wow.
It's an amazing for whatever.
Stem cells next. No.
Well, hopefully not.
Yeah.
I tell you what, that has been
Shockwave
shocking.
shit.
The results, they're not humming. Yeah.
All right, ready?
Yeah, we're going. Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. I'm here with Doug. What's up, Doug?
Not much.
So Doug has been a patient of mine for how long? Or at the clinic, I should say.
Since 2015.
And tell us a little bit about yourself, because you're very physically active. You're a competitive jiu-jitsu competitor, father, law enforcement. What don't you do? Let's talk about what you do.
It might be easier sometimes. Yeah.
So tell me, you were on radio. How old are you? Tell us a little bit about yourself.
42 years old. So I've been seeing you guys since 2015. And as far as activity, I mean, I work out probably 2 hours a day, and then I go to the gym and do jiu-jitsu.
So you weight train 2 hours a day?
Yeah, cardio and weight train, and then jiu-jitsu, and then like you said.
And where do you do jiu-jitsu at? You do that over?
Grove City, Brazilian Jiu-Jitsu. Shout out to them, because they're the best gym in town. Not that I'm biased.
But how many hours a day are you doing that?
Well, it's not every day right now. Just like Mondays, Tuesdays, Wednesdays, Thursdays, Sundays.
Okay, so almost every day.
Almost. I haven't been able to get into the Friday class, but we're going to try to start that up again too. So, yeah, hopefully 6 days a week is where I'll be there. And then
your significant other does jiu-jitsu too.
She trains with me, so
who's tougher?
Her.
Okay.
Yeah, she's tough as nails. That's no doubt there. She trains with me actually. She trains at Buckeye Fitness with me for the weight training, and then straight over to Grove City for the jiu-jitsu, and we're actually starting Muay Thai up again too. So there's a lot of cardio happening every day. So
I mean, you have two boys?
No, we have a lot of kids.
How many kids you got total?
We have 5. I've got I know, right? And 22-year-old, 21-year-old, 19-year-old, 18-year-old, 16-year-old. So they keep us busy.
Okay. And then you're also full-time law enforcement.
Full-time law enforcement, and if I could be full-time fighter, I would, but it doesn't pay the bills. So,
yeah. So pretty much, what's a typical day? What time are you waking up?
I wake up at 4:45 every morning. Get ready for work. I work 6 to 2, assuming there's no overtime, and then by 2:30 I'm at Buckeye Fitness, and then except for Tuesdays and Thursdays when I'm at Buckeye PMR. So that switches up a little bit. So I either go to Buckeye PMR or Buckeye Fitness. I get treatment with you guys for chiropractic and physical therapy, and then I work out at Buckeye.
And jiu-jitsu, and then what time do you get home at night?
Usually between 9 and 10 o'clock at night. Then prep our food and get ready for the next day.
Dang. All right, so for most people listening, that sounds crazy,
it may, and then I think a lot of people would, especially in your field, say, "Hey, Doug, you probably should get more than 4 or 5 hours of sleep a night." But I mean, life is what it is. So, which is also why Buckeye helps me out a little bit. So,
and when you first started coming in, so you started coming in, what age were you when you first started coming in?
Well, it was just 3 years ago, so 39.
Okay. And what were you experiencing? How did you end up there in the first place?
I had actually been in a car accident, and I ruptured, I don't know if it matters which ones, but I ruptured 2 discs in my neck, 2 discs in my back, and ended up with a tear in my shoulder. It was a T-bone accident. Someone ran a red light, hit me. Not my fault, for the record. And so that was actually where I'd heard great things, obviously, from you guys. So I went over there because I'm kind of anti-surgery. And I like the idea of using like the most unintrusive means possible. So physical therapy is great for me. Chiropractic work, all of that. Anything that can help my back without cutting me open, I'm all for it.
So that worked out for you. You recovered from those injuries.
Recovering. I mean, they were not the they were not slight.
You had herniated discs in multiple areas, which can be surgical if not treated properly.
Right. So yeah, then that's why we've been I said keeping up with physical therapy and the treatment, and you know, I go to the Grove City branch, so the guys over there like CJ and everybody have written up all my physical therapy programs. I try to follow them. I follow them when I'm not.
I think they give you a lot of stuff to do on your own. Cause,
Yes.
you know, a lot of physical therapy stuff you don't have to do at the office. So with a lot of our patients, you know, especially if we know someone disciplined like you, we'll give you a routine and say, you know, do it on your own. That'll save you the time of coming in.
Absolutely. And I unfortunately got injured once in a jiu-jitsu tournament where I tore like 3 ligaments in my leg, and
that was an ankle injury, right?
it was an ankle injury. There was a tendon and 3 ligaments that got torn, but not surgical. So again, CJ gave me a program because I said, buddy, I'm already here twice a week. What can you give me to do on my own? And we had it back up and running in about a month. I was good. So,
I think they wanted to do surgery, did they? Or they was on the
deltoid.
Yeah, the deltoid ligament. So if anyone ever rolls their ankle, that's the ligament on the outside. That's the one you always get. What, did someone do a heel hook or something on here? Or what was it?
It may have been an illegal heel hook in the gi.
Okay.
It happens.
The big one. But I remember that because you were talking about doing surgery. But surgery, obviously, ankle surgery is a pretty big deal.
Yeah,
you would probably go crazy if you were immobile after an ankle surgery. I don't know if you'd make it.
I would. I know I would, because like I said, we keep a pretty active lifestyle, which, you know, I have to. Which, leading into that, I mean, that's where we started doing the HRT program with you guys. So.
And when did you start doing that? What age were you?
Well, I started it right when I started at Buckeye.
So at 39, and you had reminded me. So what did you weigh?
So I was over 230 pounds. And was not as active as I am now. I wouldn't
Were you starting to feel some of the low T symptoms? Like, were you tired, or like what?
Well, and honestly, so in law enforcement, we usually work nights, and I think we get so messed up with the vitamin D deficiencies and all the stuff that's happening. I don't think I even realized how bad I was.
Yeah. And most guys don't. I always harp on the radio show that guys decline 3 to 5% a year. That's just a normal person without a lot of stress. So being a law enforcement officer, pretty much your day of stress, right? Because you don't know when the next situation is going to happen.
Correct.
On top of, you guys work crazy hours.
Yeah, I mean, at that time I worked, I think, 7P to 5A for my hours.
Which messes up your sleep pattern, which, you thing after thing. And we've seen it time and time again where, police officers, ex-military will come in. And a lot of these guys will come in. They'll go to the regular physician, in their 30s, and say hey, I might be having low T, or I'm tired and I don't have energy. And they don't even check their blood work. They'll say, you maybe have a little bit of depression. Why don't we put you on this antidepressant and see how that goes?
Luckily, that wasn't.
Yeah. So, but we see that,
Yeah.
And it's crazy. Your age has nothing to do with your hormones. So if you're listening to this show and you could be in your 20s, your 30s, your 40s, your 50s, your 60s. If you don't have energy, you get home from work, you want to sit on the couch, you're getting injury after injury because you can't recover. Those are all signs you could be having a hormone problem. And the blood work never lies. No. Get your blood work done, and if it's low, we replace them with bioidenticals, and if you don't need it, we don't do it.
Right.
But the blood work never lies, and you got to keep in mind your regular physician is not going to check your hormones, or they're not going to check them properly. A lot of times they'll just look at this thing called your serum testosterone, which really is an inaccurate number. That's the number that's between, we'll say 200 and 1100. That number is not accurate to judge your testosterone. There's a free number that you have to look at.
I was actually talking about this with your nurse practitioner yesterday.
Yeah.
So.
But most doctors, when I say most, 99%, if you listen to my show, you go to your doctor, hey, listen to Dr. Buzz, we do my testosterone levels. They're going to do your serum testosterone levels. And normal levels are 248 to 1197. And what they'll tell you is if you're between 248 and 1197, hey, your testosterone's fine, which couldn't be farther from the truth. I mean, and the reason there's such a big value is when they set up these lab values, they take guys that are 65 to 25, and as long as you're in that group somewhere, we say what they call normal, which that's definitely not optimal.
Right. And I mean, for me personally, I like to know I'm going somewhere that's worried about me and getting me to where I need to be. And they said, I was talking about this with your nurse practitioner in Grove City yesterday, and she wouldn't even tell me that number, and she's like,
It
that number doesn't matter.
It
She's
doesn't
like, that number
matter.
doesn't matter. I was like, oh, okay, fine. That's just the number I knew because that's what everybody hears about. So.
Yeah. So if you're listening and you're thinking about your testosterone's 200, 300, 400, 500, that doesn't even matter. That number is irrelevant. The free testosterone number, which is usually going to be a number where you want it to be, once again, labs have different values. The lab we use, we like that number around the 20 range. That's where you want to be.
Which is where I'm at now, actually.
Oh, beautiful.
So, yeah, and that's why I like your guys' program, because you can fix it on the fly, so to speak, weekly injections, and I said you can tailor it to me, exactly to what I need. So, and like you were speaking of, the energy levels are they're crazy if you think about it. Like I see all these guys, like you said, we go to the gym, we have these kids programs, these kids are rolling around like crazy, and their parents are all sitting there on the bleachers like, oh man, those kids have so much energy. Yeah. I'm like, so could you.
Yeah, there's no reason you can't have energy like a 25 or 30-year-old for the rest of your life. You might not always look like you're 25 or 30, but you can have the same exact energy level if you have your hormones there.
Right.
And you have the same ability to recover. Because a lot of people don't realize it is your recovery, as you get older and you have more aches and pains, a lot of that's due to your hormonal system. Because if you don't have testosterone, you don't have estrogen, you don't have growth hormone, I don't care what type of PT, stretching, chiropractic you do, you're going to have injuries because your body can't recover, period.
I mean, recovery's key.
Yeah.
Yeah,
and the reason most people quit working out is, number one, they don't have the energy. Number two, they have too many stinking injuries. You know what I'm saying? Like, I just can't, I used to, how many guys I meet at the gym, I used to work out, but my knees hurt too bad or my shoulders hurt too bad. Well, it's not because you've been training a long period of time. Weight training makes your joints stronger. Right. It's the decline in your hormones over time that you can't fight inflammation, and that takes you out of the game. And the other thing that a lot of people will say is that they get older, they sleep terrible. How many people we talk to, how's your sleep? Oh, it's terrible. I get up multiple times a night.
I may have mentioned that.
Yeah. I mean, but that's also hormonal.
Yeah.
So if you're getting up multiple times a night, or you're not sleeping like when you're younger, that's totally reversible. So you're crazy not to do it. Crazy.
No, I mean, we have our optimal numbers for a reason. Like,
that's what anti-aging is.
Yeah.
And at some point, everyone has to decide, hey, am I just going to be okay getting old and being old? Or am I going to fight the fight and try to stay as young as possible? And you got to picture, you're not only doing it for yourself, you're doing it for your family, and for in your case, your coworkers. You're on a team of police officers that need you to be.
Yeah, I need to be fit. I need to be able to help them out. I need to be able to solve whatever problems at hand. And if it's that 18-year-old kid who wants to fight me, if I'm unable to do so, then that's not good for me.
Can't be the police officer with the donut.
Right.
I haven't said that.
No, it's fine. I don't mind that joke because I don't eat donuts. Yeah. So, but yeah, and like you said, I have, as you mentioned, my kids earlier. I mean, one was wrestling in college, one's about to wrestle in college. I want to be able to hang with them, and they said they have high energy levels, and I don't want to be, like you said, the dad on the couch who's like, oh, those are my kids. I can't do anything with them. So.
And the other thing, you probably realize this, if you lead by example, if as you get older, you're in your 30s, 40s, and 50s, and you're still exercising and doing stuff, that's a great example for your children.
Right.
And unfortunately, there's an epidemic of obesity even in middle school and high school kids. But then you see the parents, and the parents aren't eating properly, not exercising. How's the kid supposed to learn that exercise should be part of everyone's routine? Doesn't have to be as hardcore as you, but something
honestly,
at least a few days a week.
I think it becomes addictive, and not in a bad way. Because I get upset if I can't go to the gym. Not in a horrible way, but I'm like, every day I got my routine now, and I like to get my cardio time in. And
that's a good addiction. It's not a bad one.
Right, it's not a bad one. And we actually, I think we kind of glossed over this. We got sidetracked. But like you said, when I first started doing any HRT, I was 230 pounds, and I dropped 60 pounds doing that. I mean, it's not a miracle drug. I had to change my diet, and I had to start exercising.
But it gave you the motivation to do so.
It gave me the motivation, the ability to recover. It gave me, the energy to go do it, and you don't realize how much it's helping you until, you step back and look at it and say, oh my goodness, I could have been doing this, like you said, in my late 30s, early 30s, I could have started this and been way better off than I am now. But
one of the things we hear all the time at the office is people, once we fix their hormones, some of them, their biggest regrets. I had a lady on the show a few weeks ago that she's like, she literally wasted 25 years of her life. She was miserable. She was on antidepressants, and she got on hormones, and at 60, and she's like, me and my husband were laying in bed and just realized I wasted the last 25 years of my life feeling miserable and didn't even know this was something that was an option. So don't be that person. Get your blood work done. If you don't have energy, aches and pains, sleeping terrible, depressed, come to Buckeye, get your blood work done. It's usually covered by your insurance. If not, it's inexpensive. And get your hormones checked out, and just realize you can feel like when you were in your 25s and 30s, your whole life energy-wise. You can't turn back the clock, but you can turn back the biological clock, and we know that's a sure thing.
Right.
Now,
at least give it a heck of a run.
That's what I'm doing.
Yeah.
Now, we talked about, so we have you on bioidentical testosterone, and what's important to realize, the way we do it at Buckeye, that's very important, is we only use bioidenticals, and what that basically means is if we prescribe you testosterone, whether you're a male or female, is we give you the exact same testosterone molecule your body used to produce. We don't use synthetics. That's very important, because a lot of people are listening, and they'll say, well, testosterone's bad. It can cause heart disease and prostate cancer and all this stuff, heart disease. That's incorrect. Synthetic drugs that mimic testosterone can, which we don't use. But using a bioidentical testosterone, estrogen, or progesterone, or whatever we put you on, there's no side effects. There is none. Because there can't be, because you're simply replacing what your body used to produce. So if you're listening and you're taking something, you're wondering if it's a bioidentical, if the medication you're taking comes with parchment paper in the packaging that has all the bad side effects, you're not on a bioidentical. Because bioidenticals don't come with any warnings. Because there is no side effects. So if you have parchment paper with your hormone or whatever you think you're taking, it's a drug that mimics a hormone. We don't do that stuff. The other thing that we do with guys is, if you're on testosterone, you should also be taking HCG, which is human chorionic gonadotropin. And basically what happens in males, if we put you on testosterone, or if you're on testosterone somewhere else, your body will quit producing testosterone if you don't take HCG with it. So HCG boosts your own testosterone production, because really the proper way to treat testosterone deficiency in males is, number one, get your body to produce more testosterone on its own, and that's what HCG does. Then if you need more on top of it, then we can give you bioidentical. But if you're taking testosterone somewhere else and you're not taking HCG, you're just really wrecking your own system. And if you ever decide to get off of it, you're going to have none of your own. You'll be in a crisis. So that's essential you take HCG. Another thing, we're going to cut the break, but we're going to come back and we're going to talk about growth hormone and growth hormone boosters. You've had some good success. I remember the first day telling you about it, and you were kind of on the fence.
Yeah.
So we're going to come back and talk about how to boost your growth hormone levels. This is Dr. Buzz with Buckeye Physical Medicine and Rehab. Check out our website, buckeyepmr.com.
All right, about 9 or 10 more minutes. Sounded good.
Oh, yeah, good. I'm not too quiet or anything.
Nice.
No, it's good. I knew you had your law enforcement officer, so I know you know how to speak up. Because you've got on your job, you've got to speak up so people can understand you. If you just whisper, they're like looking at you like, what? Ready?
At least, yeah,
I'm ready.
Oh, okay. What were you going to say?
we're fine.
Oh, okay. I thought he was going to throw in something and say, okay, I want to mention this, or I want
No,
to
it's
mention
nothing that important.
Oh, okay. Well, just throw it in. Interrupt Buzz if he's talking too much, and just
go
say,
ahead,
I want to say this.
Yeah, go ahead, it's your show.
Yeah, well, I think that's not true.
Ready? Here we go.
Yeah, ready. Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. I'm here with Doug today, and we're talking about hormone replacement, bioidentical hormone replacement, and we want to talk a little bit about growth hormone boosters and how to boost your growth hormone levels. One of the things we do at Buckeye is we test your growth hormone levels, and sometimes in people, your growth hormone levels become depleted with age. And eventually in everyone they become depleted with age. But once again, it's not age dependent. But some people in their 30s are fine. Some people in their 50s are fine. But then the reverse is there's people in their 30s that have low growth hormone. And growth hormone's essential for heart health, for your skin health, connective tissue, anything along the connective tissue line, which is your blood vessels, everything. You got to have growth hormone levels. And in your situation, doing jiu-jitsu, tendons and ligaments.
Yes.
Testosterone is an anti-inflammatory, but doesn't do anything to heal tendons and ligaments. Growth hormone is what heals all those connective tissue. In your situation, we had a little bit of an issue. It was lower than it should have been.
Correct. Yeah.
Probably due to stress and who knows, whatever. A lot of it's genetic.
It could be age. I'm not.
Yeah, well, you're getting there. So, and there's a few ways you can increase growth hormone levels. And the first way that we don't do at Buckeye is you can take growth hormone. A couple problems with taking growth hormone. Number one, it's very expensive. Taking growth hormone at a dose that would be a benefit level to someone would literally cost $3,000 to $4,000 a month. Super expensive. It's a very complex molecule. And the other problem with that, kind of like we were talking about testosterone earlier, if you're taking just regular growth hormone, it works on a negative feedback. Your body will quit producing it. So the downside to that would be growth hormone is essential for you to live a long time for your heart and lots of connective tissue. So let's say someone would prescribe you growth hormone for $3,000 a month, and you take it for 10 years, and when you get 60, you decide you don't want to take growth hormone anymore. You're going to be in a huge problem. That's why we won't even prescribe it. Yeah, okay, and you don't need it.
It was never an option. I know that. So.
Yeah, we wouldn't even do it because it's too. In my opinion, it's not safe, and we don't need it with the growth hormone boosters. And the way you boost your growth hormone is we use two products. We use a product called Somorlin, and then we also use a product called GHRP2, and they're mixed together. The cool thing about your pituitary, which is growth hormone, where it's produced, is your pituitary never loses the ability to produce growth hormone levels as when you were a child. That's really cool. Unlike, testosterone over time, eventually everyone's going to lose it, but your pituitary doesn't lose that ability. But what does happen is your pituitary needs this hormone called growth hormone releasing hormone, which is GHRP, and that over time decreases, so your pituitary produces less growth hormone because it has less of that growth hormone releasing GHRH hormone. Somorlin mimics that. So Somorlin signals your pituitary to produce growth hormone like when you were younger. We have another problem. As we get older, we also produce this hormone called somatostatin. Somatostatin blocks growth hormone. So even if we just gave you Somorlin and you produce more growth hormone, the somatostatin would null the effect of it. So the GHRP2 we use blocks somatostatin. So we get you to produce more growth hormone, which is safe, because your pituitary will only produce what it'll produce. You can't overdose on it. And we block the somatostatin, which is an aging hormone, so you can actually utilize the growth hormone. And the combination of the two is very effective, very safe. Somorlin's been around for 20-plus years. They actually developed it when kids were dwarfs. They started out giving them growth hormone, but the problem when they gave a kid growth hormone is they had to take it for the rest of their lives because it would ruin their own pituitary. So the Somorlin for children worked very well because they didn't have any somatostatin, and it stimulated the pituitary to produce like it was supposed to, solving the dwarf problem. But the somatostatin thing, as we get older and we produce more of that, the GHRP2 solves that problem. Then the combination worked great. Tell us about your experience. So you've been on.
So yeah, you talked to me about it at the office one day, and
I think it's because your ankle was messed up and you have a hard time losing weight or something. I forget what it was.
Yeah, I mean, like I said, I'd lost a lot of weight.
I think you saw someone else doing it and you were like, man, what's he doing? And I was like, okay.
Well, if you may remember, it's someone who's been on your show quite a bit.
Yeah, Mike.
Yeah. I didn't know if we were allowed to name names.
Yeah, Mike's cool.
So, yeah, so I know Mike mentioned it, and he said, you need to talk to Buzz, and then I talked to you at the office, and you're like, oh, yeah, we got to get your blood work done. So
make sure you need it, because if your growth hormone levels are fine, we don't do it.
Right. Yeah. No. I mean, like you said, we have to test you first. So we went through all that, I guess. So to get to the bottom line, I started taking the Somorlin and GHRP2, and I guess again, I think I was hoping for a miracle drug, and then I was told that we have to. It takes a little bit to kick in. It's not like you take a shot and the next day you're Popeye. Right. So I said I stuck with it, and it took me probably like three months. I started seeing a difference.
3 months is when it kicks in.
And then that 3 to 4 month range, I was like, oh my. Yeah. And I think I don't know. You would be able to answer this if it works a little bit differently for everybody, because I know a lot of people say they burn fat like crazy with this stuff. I know I put on a lot of muscle mass since I've been using it, which I'm not going to complain about. So, yeah, that's
it helps with muscle mass, helps with decreasing body fat. It literally changes your physique.
Yeah, you get way more vascular, and I've noticed that a lot in working out. I'm like there's veins in my chest that I've never seen before. I'm like, again, not complaining.
As you lose the body fat, what's happening there?
Yeah, and I said I got a personal trainer to help me with my workouts because I do have a lot of injuries, and when I had to tailor some things. So, working out correctly, using Somorlin, and then having diets written for me, and the combination's been an amazing change.
Would you say you're in your best shape of your life right now?
Oh yeah, no, it's not even. So I was in the Marines, and I was very thin and very fit when I came out of boot camp. But honestly, I am so much stronger today than I was at 20
and how old
years
are you?
old. 42.
So 42, lifetime best shape.
Absolutely. I mean, I know nobody cares about numbers per se, but I remember when I used to work out constantly in the Marines, my max bench press was 255 pounds, and I was very proud of that. At 168 pounds, I could bench 255. I was a fit kid. A couple months ago, we went through the maxes to check everything what I was working out with, and I was up to 335 on the bench press. So I'm not even close to what I was when I was a 22-year-old kid. And so yeah, I can't argue best shape of my life. And it's a combination of eating right, working out right, and like I said,
Make sure your hormones are all balanced out.
hormones are balanced, and having you guys keep me put together.
Yeah.
Like all that in combination is what's helping.
So if someone's listening to the show here, and what's sad though is probably they've been on the couch. There's no way I can do this. So,
Again,
step one is that
230 pounds to 172 pounds in a year.
Yeah.
You can do it.
Yeah. And if you're lacking the motivation, or you mean, you don't have. Everyone has time. There's plenty of time in the day. There's 24 hours, so we all have time. But if you don't have the energy or whatever, step one is get your blood work done, get your hormones balanced out. And if you think, well, I feel fine. How do you feel now compared to when you were 25? That's how you don't compare yourself to how you did last year or how you think you feel. How do you feel now compared to when you were 25? And if the answer is not the same, get your blood work done.
Right, and hopefully you'll be like me and be better.
Yeah. Hey, well, thanks for coming on the show. I really appreciate it. This is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. Until next time.
All right.
Thank you.
Switch that off.